Hi, my name is Dr. John Martin. I am president of Women's Health Associates of Southern Nevada. I think really what we do is we supply complete obstetric gynecologic care. We can take care of high-risk pregnancies. We can take care of GYN problems. There really isn't any aspect of GYN surgery that there isn't an expert in one of those fields to take care of patients. Of course, we have referrals to high-risk pregnancy specialists and GYN cancer specialists, but for most common GYN problems, if a physician at a particular care center is not comfortable taking care of a particular patient, they can refer it to somewhere within the Women's Health Association practice. So that's the advantage. But also it's the training for the physicians. It's to going and learning new techniques and new technology and really trying to help one another improve. And it goes back to that collegial atmosphere that we really try to promote. Everybody's an equal within the practice. Everybody shares information. Nobody looks at each other as a competitor. And that's very different from where we were before. We were all in our own little worlds, competing against one another and not sharing information and sharing things that benefit the patient. So again, that's a big plus of combining this large group of physicians together. Is we are now working together for the health care of our patients. Rather than cite a specific care center, because there are several who offer but robotic surgery, we have several surgeons who do robotic surgeries, and they do minimally invasive surgery. That's the small incisions and quicker recovery for patients, and that's done at many of our care centers. There are surgical specialties for helping women with incontinence or vaginal prolapse and all sorts of GYN complications. I think the biggest thing is that really we are available to help women with any problems they have, and we will, if we can't take care of them, we'll get them referred to the correct person either within our practice or outside our practice to make sure that we take good care of them. Well, I think one of the things that we're really trying to emphasize is convenience for our patients. Ultrasounds done on-site in the practice or care center office, availability of information, trying to do office procedures so it's more convenient for patients. So many doctors' offices, because of costs, and again, this is the benefit of being larger practice, can't afford to have outpatient surgical procedures in their office, and we can do that. And again, we allow somebody to refer within the practice to another office. I'll give you an example. For me personally, I don't do, there's a tubal ligation process called an e-sure, where you actually help a woman prevent further pregnancy by inserting something in her tubes. Well, I don't do that procedure, but 4 other doctors within the Women's Health Associates of Southern Nevada do that, so I'll refer to them for women to have that procedure.